It is a well-known fact that pregnancy is one of the hardest things that a woman will ever do. And in turn, it is also very well known that people living with diabetes, any kind of diabetes, that will also be one of the hardest things that they ever do. So, in conclusion, imagine combining both of those hard things, pregnancy and diabetes. I have lived that life now 2 times, and I'm here today to talk to you guys about it. For those who are new, hi, my name is Olivia, and I've been a type 1 diabetic for over 20 years. And in that 20 years, I have done my best to make living with diabetes more enjoyable and more sustainable. And I come here on YouTube to help other diabetics do the same. Whether you're type 1, type 2, gestational diabetic, any of it, I'm here to help you guys out. And today we are talking about pregnancy and diabetes. And that is because, to be quite frank, me and my husband have been trying to get pregnant with baby number 3. And being said, it has brought to surface a lot of the hard facts about living life with diabetes while being pregnant. So I thought it would be a great idea to come here onto YouTube to talk about that with you guys today. Maybe you are trying to get pregnant and you're a diabetic. Maybe you are already pregnant. Maybe you're thinking about getting pregnant. Regardless, there are some things I think every diabetic should know before jumping into pregnancy, because if you jump in without knowing some of these facts first, it can be like jumping off a bridge, to be quite honest. So I think if you go into pregnancy knowing all you can about your blood sugars and the best way to go about things, then the better you will be. So to start things off, I have 2 children. I have an almost 4-year-old and I have a 2-year-old, and we are trying to get pregnant with number 3. So I have lived through 2 successful pregnancies with my type 1 diabetes, and I want to talk to you guys a little about what you can expect while being pregnant and living with diabetes. So to start, blood sugar regulation is huge. It's one of the biggest factors in pregnancy. It's what your OBGYN will expect of you. It is what your high-risk OBGYN will expect of you, and it's what your endocrinologist will expect of you. Now, if you are a first-time pregnant person, expect that your doctors will not always agree on things. And I will start off by this one fact, because it was almost the most comical part of my pregnancy with both pregnancies, was that my endocrinologist had one opinion on how to handle my blood sugars, and my OBGYN had another opinion. And that is because, and I think everyone needs to remember this, that it is an OBGYN's job to take care of your baby and your pregnancy. And it is your endocrinologist's job to take care of you, the mother. So being said, sometimes those 2 things don't combine very well. And a quick example of that will be my blood sugars while exercising. So as a side note, when you are pregnant, you have to have a very tight control of your blood sugars. It is recommended that your sugars are kept between 65 and 120 all of the time for the most part. When you are fasting, when you first get up in the morning, it is recommended that your sugar is between 65 and 95, and 2 hours after eating, it is recommended your sugars are about 120. So being said, waking up first thing in the morning, having your sugars between 65 and 95, if you are a morning exerciser like me, it is very hard to wake up and do an exercise routine, or wake up and take care of children, wake up and live your life when your sugars are running that low. So during my pregnancies, my doctor, my endocrinologist had said, I know that they're telling you to keep your sugars that low, but I think it's more important that you wake up, you exercise, and you don't suffer from hypoglycemia, low blood sugar. I think it's more important you keep your sugar slightly elevated at 120 when you wake up in the morning. That is something that my OBGYN 100% did not agree with, but in that case, I had to go with what my endocrinologist was recommending me, because for me, fitness and exercising through my pregnancy was very important. So to start off, if you are going into pregnancy with diabetes, just anticipate that your doctors will not always agree with what is best for your care. So you have to use your own knowledge and your own facts and your own judgment to make the best call. Another fact you guys need to know about being pregnant with diabetes, like I said, is that very strict blood sugar control. And the reason that is so important is because when you have elevated blood sugar during pregnancy, that affects the baby. That also affects you. So it could go either way. But a great example of this is when your sugars are high during pregnancy, your baby has to compensate in their own body, making more insulin to bring their sugar down. So when you are going throughout your whole pregnancy with high blood sugar, your baby will be making more insulin because they're not diabetic. They have a working pancreas. They will be making more insulin throughout your pregnancy, causing them to be bigger in size. My son was very normal sized. He was 7 pounds and 3 ounces. I had him at 37 weeks. He was pretty normal, but I was guilty of having a larger baby my second go around. She was 11 pounds. Oh my God. She was not 11 pounds. No, oh my gosh. She was 8 pounds and 11 ounces, but she was born early because she was so large. She was born at 36 weeks, so a month early, and she was almost 9 pounds. And because of this, it warranted a C-section. So with pregnancy, C-sections are a little bit more common, but if you are a diabetic and you're looking to have a natural vaginal birth, it is 100% possible and you are 100% capable of doing that. But to give yourself the best chance of a successful vaginal birth, you need to keep your sugars as regulated as possible. I did try a regular birth, vaginal birth with both of my children, and unfortunately both times were very unsuccessful. My first pregnancy was because my son was giving me a hard time and his heart rate kept dropping, so they opted for a C-section. And for my daughter, she was so large and she could just not come on out, and they had said that to get her out, they were actually going to have to fracture her collarbone, so shoulder dysplasia, to get her out there. So my husband and I had opted for a C-section there as well. So if you are pregnant and diabetic, C-sections tend to be a little bit more common than non-common. But if you have yourself a really tight control throughout the entire pregnancy, then you are better chances of having a normal vaginal birth. The recommended guidelines for your A1C during pregnancy is below 7% A1C your first trimester, so the first 3-4 months of pregnancy, and then below 6% the second and third trimester of pregnancy. And I had previously gone over the blood sugar limits with you guys, fasting and 2 hours after eating. So that is kind of your guidelines there with what you're looking for. But I'm not a doctor, I'm not a nurse, I do not work in the medical industry at all. All I'm just talking to you guys about is what I have lived myself as a type 1 diabetic who has now lived through pregnancy 2 times. Another thing you should know about if you are looking to get pregnant or you are pregnant with diabetes is just like every other pregnant person in America, your first trimester, you will feel pretty crappy. You might be throwing up, you will definitely feel nauseous, and you will be very, very tired. And all of those things have an impact on your blood sugar you need to be aware about. Both pregnancies, I was so unbelievably nauseous. And the only way I could curb that nausea was by eating carbs. So pretzels really helped, crackers really helped, apple juice really helped. And as we all know, those things all send your blood sugar sky high. So handling those side effects of nausea and sickness in the first trimester of pregnancy is extremely hard with diabetes, just because you can't have, or it's not recommended you have as much of those things as a regular pregnant person would. I know one thing that they have out in the market right now are those like lozenges you can suck on if you feel nauseous, but unfortunately they do not have a diabetic friendly version of that. So when you're pregnant with diabetes, you have to do what works best for you. And that's where I'm saying, I know that every pregnant person does the best for themselves and their babies. But when you feel sick and when you feel crappy, you have to do what's best for you in that moment to get yourself out of that. So if that involves eating some pretzels and eating some crackers, then do it. I know with my first pregnancy, with my son, which honestly, this will make a lot of sense. My son, like I said, was born at a more normal size where my daughter was a little bigger. With my son, I was very hard on myself. I was afraid to eat. I was afraid to eat carbs. I remember I ate salads the entire pregnancy. I was afraid to eat pasta. I was afraid to eat bread. I was afraid to eat snacks. Whereas my daughter, when I felt sick, I ate what sounded good because I didn't want to spend that whole 9 months feeling ungodly awful. So when I felt sick, I'd have some pretzels, I'd have some juice. If I was craving ice cream, I'd have some nice low carb ice cream. Where my son, I didn't do anything like that. I ignored all my cravings. I ignored every nauseous moment of mine, and it was harder. And maybe in the long run, people will say, you did the best by, you did the best job you could in your first pregnancy. And maybe that is true. But in the moment of being pregnant and you're feeling so bad, you have to do what's best for yourself. And if that means eating a few carbs, then do it. But needless to say, eating a low carb diet while pregnant does make the job a lot easier in the long run, and a lot low risk of diabetic complications, and a lot less risk of having issues with your child. Another cool thing that I started back in January, which if you are new to my channel, you don't know this, but if you've been around, you know, I do have the Omnipod insulin pump as well as the Dexcom G7 CGM service. So with both my pregnancies, I did have this. And when I had met with my endocrinologist about a year ago, I was very, honest and to the point with her that we were open to having another child. And she had recommended that through this next pregnancy, I get started on the Omnipod insulin pump, get myself used to it before jumping in. And it would help me have more control and less blood sugar spikes in that pregnancy. So I'm actually wearing it on my leg. I'll show you guys right here. So I've had this set up for just about 7 months now. So I've definitely had a good trial run at it. So I feel comfortable using this now. And I have seen an improved difference in my A1C, my blood sugar numbers, and I experience way less high blood sugar and way less low blood sugar in my pregnancies. In general, well, I'm not in my pregnancies, but in my regular life, what I more so mean. But regardless, so that is one initiative I am making towards this third pregnancy in hopes that it would make it easier. So that is kind of the groundwork, the laying out the groundwork for you guys of what it's kind of like being pregnant with diabetes. If I'm being quite honest, it's really unfortunate. And my friends and I have all kind of gotten pregnant around the same time, me being the only diabetic. And it's always been really frustrating for me when they order pizza every night, they go out for ice cream, they can enjoy themselves. Because if we're being honest, when women are told their whole lives that they need to watch what they eat, they need to be skinny, they need to be healthy. But when you're pregnant, kind of all that goes out of the window. And unfortunately for diabetics, that is not the case. For diabetics, you cannot eat whatever you want through pregnancy. You cannot spend your nights eating gallons of ice cream. You still need to be on your best behavior. And to some degree, that sucks. And I think we all need to understand that and accept it because it's very true. But just remember in the highs and lows of your pregnancy that you are doing the best you can to bring a healthy baby into this world. And it's not easy whether you're diabetic or whether you're not diabetic, but just consider yourself, if you are a diabetic and you are pregnant right now or you're planning to become pregnant, you're doing a great job. And it's a hard job when you're diabetic. I know that both of my children, once having them, both my kids experienced low blood sugar spells. So they had to have like a gel glucose administered every so often. They had to get their blood sugar checked. And if you guys experience that too, that's just because, like I said, you may be diabetic and your pancreas may not be working, but your baby still does have a working pancreas. So when you have high blood sugar, they have high blood sugar, but their pancreas is trying to fix it, which can cause, weight gain because insulin is a growth hormone. But it also means when they get out of the womb and they are no longer dependent on you, that their pancreas will be used to producing that much medicine, that much insulin, and it will cause them to have low blood sugar. So if you experience that, I experienced it both times. It was very scary, but both my kids got through it. Neither of my kids are diabetic thus far. They're both very healthy, very happy, normal weight size. They turned out great. So if you are diabetic and you're stressed out about what life is like, it's going to be okay. If you guys want to share some of your stories below, leave it down in the comments. Or if you have any questions about me and how I manage being pregnant with diabetes, leave that in the comments below either. And also, as a disclaimer, as mentioned before, I'm not a doctor, but also this video is more so catered to the type 1 diabetics and type 2 diabetics of the world. I obviously did not have a clue about gestational diabetes because I did not have to live it. Although diabetes requires a lot of testing while you're pregnant, that's another thing you guys should be aware of. You will have more doctor's appointments. You will see a high-risk doctor. Besides the point, you would take a lot more tests because of your diabetes. But one test you do not have to take when you already have diabetes is the gestational diabetes test that they test every pregnant person for. So that's exciting, very exciting for that. One of the silver linings of being pregnant with diabetes. But regardless, if you guys are interested in hearing more about my experience through my pregnancies with diabetes, like this video, give this video a big thumbs up. It helps me and my channel out, and I will see you guys in my next video. Bye.